Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend, Colin. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff so much. So join us as we discuss the latest healthcare and health IT news meshed together in new ways, which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be discussing 2019 Health IT trends, and today's episode is sponsored by the HITMIC Conference. You can learn more about the conference and the community at hitmc.com. Be sure to follow the show on Twitter and the hashtag HITSM, and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 13 years of Health IT blog content. healthcareittoday.com. It just got a new facelift at healthcareittoday.com, so be sure to check it out and find all the great content. So Colin, are you ready to talk 2019 trends?
Can't believe it's the new year already, John, but excited for it.
Yeah, I mean, it's amazing to think it's 2019. Someone was asking on Twitter, should we now start referring to it as the 20s? Just like we did the 80s and the 90s. Like,
That's
when
right.
is it appropriate to start saying, oh, it's the 20s? Or
right.
I guess that's the year after. So amazing.
Got another year of our teens.
We're getting younger, I think.
That's right. That's right. Yeah, so today we've got quite an interesting agenda. We're basically going to be talking about what we're expecting in 2019. So first up, we're going to talk about something that I know you've predicted, John, and that is voice and healthcare. How are those technologies going to be brought into healthcare? We're going to then dive into talking about sensors. That's both the ones that are, of course, in your wearables, but also other types of sensors. We're going to talk about that and how that's going to impact 2019. We're then going to jump into what our predictions are for the upcoming year. And then in line with everything we do here at Healthcare IT Today, we're going to bring this prediction down to something practical. And we're going to say, hey, what do all these predictions really mean for you? So that's today's agenda for the discussion, and we'll get right into it. I'm excited for this, John. It should be fun.
Yeah, definitely. It's always fun to predict because you can't be wrong if you're predicting.
Well, that is until someone listens to this
next
a year from now, right? And then kind of calls us on and goes, hey, you guys predicted this, and that just didn't happen.
It'll be a new segment where John was right and where John was wrong.
Yeah, there you go. That'll be fun. That'll be fun. All right, so let's talk about the first thing. So, John, you were asked recently about what is going to be hot in 2019, and your number one was voice in healthcare. Do you want to kind of run us through that?
Yeah, I mean, it's really kind of astounding how just in 2018, voice has taken over so many parts of our lives. I told the story recently of my children. One time we said, hey, will you Google something? And they're like, Google it. And then said, Alexa. And then they asked the question to Alexa. Like, they didn't even think about Googling. They just wanted to ask Alexa everything. So it was such a big difference, for them to, use voice. And I think we're seeing that across the spectrum. So, if I look at voice in healthcare, certainly we see the addition of voice assistants. And I think that's true in the consumer segment. And if I'm making a big prediction here, I think we're going to have our first physician office visit over some sort of voice assistant, whether it's your phone or whether it's some at-home device. I think we're going to see that in 2019, where you're literally seeing the doctor through your voice assistant. And when you look at some of the different versions that include video, I mean, that's telemedicine essentially. But, I think some will even just happen directly through voice. The other one we're seeing big time is even in every EHR is working on some sort of voice-powered interface. So we're seeing that happen in big ways. I mean, I saw it firsthand at the Meditech user conference. They're doing it together with Nuance. Nuance is powering a lot of what they're doing. And then also with the Google Voice stuff on mobile, where they're literally, the doctor could say, order 500 grams of amoxicillin 3 times daily or whatever, right? Where it could be done through the voice, or even just accessing the data. Hey, what are the next 5 appointments available on my chart, or things like that. I think we're just going to see a plethora of those options. And what's ironic is Nuance has been doing voice for forever, right? Like with Dragon Naturally Speaking. So I'm sure they're looking at it and say, wait, voice is in healthcare? But I think it's a new version of voice. Before it was essentially replacing transcription. Now it's actually using voice as the interface.
Yeah, no, I agree with you. I think this is going to be a big topic in 2019. I'm most interested in the voice interface part, where it's going to be the interface for physicians to interact with the EHR potentially, especially around, hey, like, imagine calling out in the exam room, can you bring me up Mrs. Smith's last lab result, and then having that system read it back to them instead of having to go in and click and click and click, right? Just being able to do those kinds of commands. I think those will be coming in 2019. It'll be very interesting to see the impact. I'm also interested to see what healthcare organizations are going to do, especially as voice does become that replacement for Google searching, or as Google voice enables everything that they have. Like when I say, hey, what are typical flu symptoms? Unlike a Google search where you get the 20 results back and then you can see, oh, Mayo Clinic's number 3. I wonder what's going to happen now when you do that voice search and like who's number 1? Like which one are they going to pick? That introduces a whole new area of making sure your SEO is good, but also around like the efficacy and the validity of that data that's coming back through single voice responses. So I'm interested to see how that's going to kind of play itself out in 2019. Definitely a little
Yeah.
bit worried about that.
Yeah, no, that's definitely something to worried about. The other thing that I worry about is kind of this change of culture that has to happen for a doctor to use voice in the exam room. You can just imagine my mom being there and the doctor saying, "Hey, what's the list of current medications and the list of meds there?" And she's like shocked about what's happening, right? And then it almost is going to create such a new environment, and it's also probably going to make some patients angry, although I love the kind of transparency that it will provide when they hear a whole list of medications and they're like, I'm not on that medication. And so like it will kind of open up the EHR data in a new way to patients that they hadn't seen before. And a lot of patients are going to be like, wait a minute, that's the data you have on me and that's what you're using for me. So it is a fine line, but I think, in the long run, it will be a great thing for transparency.
Yeah, I think so. I think it'll be really interesting. It'll also introduce a whole new nuance, excuse the pun, around like the transcribing of voice into text and all those kinds of things. And we all complain about the autocorrect today. I can only imagine what it's going to be like once we start using voice for everything. So it should be fun, but a very
It's true, but
interesting
it should
trend.
make it easier too.
Should it should. And I just now have this vision of seeing my own mother in one of these offices that are enabled by an exam room that has a voice in it. That'll be fun.
Are we
So
going to
let's
do
move.
our intake forms by voice too? I don't
Oh
know.
man, can you imagine that? That would be. I can't imagine everyone whispering into their handheld, in the middle of the office. That would just be weird.
Yeah, let me tell you about my STD and the way. No,
Yeah,
no,
probably
probably
not a good thing. Probably not a good thing. Let's move on to topic number 2. Let's talk about sensors. So this was also on your hot list, John, around what's going to be trending in 2019. So talk to us about sensors.
Yeah, so I mean, I think this really got kicked off when the Apple Watch finally got FDA approved to do an ECG reading. Now, a lot of doctors kind of poo-pooed it for good reason because it's a single lead ECG that only has so much validity and so much accuracy. It can't do like a full, EKG would do as far as diagnosis, as far as analyzing. But no doubt it's opening up a new world of discussion. And my favorite was a response from a doctor who says, "Get the Epic template ready for the Apple Watch diagnosed condition, and how do we respond to it?" Right? I mean, that's kind of how they're feeling. And so, I mean, it is opening up a new world. I still go back to something I said quite a while ago when it comes to sensors. And the key with all of these sensors is going to be, when are they going to become medically relevant? As soon as these sensors become medically relevant, it's going to change the interaction between the patient who has these sensors and is doing their own monitoring and the doctor, because then the doctor is going to actually care what the sensor says. And I think that the Apple Watch and a few others, the AliveCore before it and other ones, are starting to get FDA approval. And as they get FDA approval, that's almost like the rubber stamp that says, okay, doctors are going to trust it. Right now, certainly it's still that narrow case because it's still a single lead ECG, but that stamp of approval is going to change how people do. And when you think about the FDA process, we're just starting to get some of those approvals. We saw it with DNA kits, we saw it with the Apple Watch, we've seen it with some other things that have happened recently. And I think in 2019 we're going to see a ton of sensors that are actually medically relevant being approved.
Yeah, it's a good point that you raised, John. I mean, I think that has been the complaint, or at least the excuse that's been given to not include the data that are coming from sensors to date, is because they're so poor, they're not medically accurate or clinically accurate, as I like to call it. The one thing I will say though is that it's relevant to patients, which I think is the more powerful thing about these sensors. Whether or not it actually gave my heart rate, it was the one thing I could use as a baseline to see what my heart rate was. It was the one thing I could use to see what my glucose levels was. And that, whether it was exactly right to the lab level, probably not, but it was good enough for me. And now I can do some self-monitoring. I could, in the case of a heart rate, I can monitor my heart rate while I'm exercising. I can monitor my heart rate when I'm at rest, and I can use that to change my lifestyle. So even though, yes, they're not clinically maybe accurate today, they definitely were very relevant to patients. And I see now that the sort of genie's out of the bottle, that now we're striving to get that accuracy so that clinicians can get on board to go, yes, you know what, we're going to take some of this data in, work that into the EHR, and make it part of the medical record.
It's interesting you use the word excuse. Like, I guess I'm going to play sympathetic doctor right now. Not doctor, but sympathetic to doctors, since I'm not a doctor. But it's so hard. I mean, what is a doctor supposed to do with all of this health data, right? I mean, I'm so sympathetic to their plea, right? Especially because they only get 15 minutes, many of them. But let's say it's even a DPC, a direct primary care one where they have an hour, a half hour visit. What are they supposed to do with all this data? And the interfaces we've provided doctors to be able to process all this personal health data is awful, right? I mean, no one's done a good job with any of that. So, I don't know. Maybe it's an excuse, but it's a good excuse, I guess. I don't
Yeah,
know.
no, you're right. I mean, the data itself today, I wouldn't use it anything for other than just some interesting background information. No more different than what my diet is, or how often I exercise. I mean, you got to take everything that a patient writes with a little bit of grain of salt. And those sensors, you're right. I mean, what is the doc going to do with it today? Because can you even get it into a format that they can ingest into their EHR? Likely not. Can their EHR even display it? I mean, likely not. So you're right. I mean, it's a pretty good excuse why they don't take that data in. However, I do go back to, I think it has changed the way patients behave. I think it has changed the way we behave as individuals, just in terms of now having some baselines and some comparables in terms of, hey, I got to 10,000 steps. I gotta be honest, I never knew that was sort of a baseline. I don't even know if it's accurate, but it's something I strive for, right? I gotta make at least 10,000, or I gotta make at least 15,000. So I think sensors can help with at least changing the attitude towards measuring your health and measuring how you're doing. I think for those that had chronic conditions, of course, now, as we see the increase in accuracy of sensors, it will make a big difference for people with chronic conditions, right? We've already seen it for a long time with diabetes, monitoring and measuring at home. Now we're starting to see it in other chronic conditions. And I think that's where I agree with you. We're going to see an explosion of more accuracy and more sensors, more clinically relevant data coming from these systems. And therefore, in 2019, I think we're going to start to see the rumbling of, okay, how do I take this information in to the EHR to make it useful, because the sensor is now accurate.
Yeah, and if you look at the post that, kind of inspired this topic, which we'll put it in the show notes after, but, in that post, I kind of look at the CES conference, the Consumer Electronics Show is what it's formerly called. Now it's officially the International CES conference, but, 200,000 of your closest consumer electronics friends. But, when it started, it had no healthcare. Then it started with a bunch of interesting fitness trackers. And they almost all were talking about, hey, how do we get this into doctors' offices? But now over the last year or two, and what would be interesting to see in this year what it looks like, but I have a feeling the trend's going to continue, that they've grown into these massive boosts and really have just become consumer products. The Fitbits of the world and the different wearables like the Fitbit have just said, oh, forget about it. the consumer is much easier than trying to get to the FDA clearance, to get doctors to trust it, to get doctors to actually use it in their limited time. So it was interesting to see that shift where they just said, forget it, let's just make it consumer, but that there is a lot of value to a consumer, even just from a social standpoint, right? I mean, the number of steps is fun as a social game between you and I to see who can do more steps. Or, and I think there are some interesting social aspects of it that are valuable to your health, but maybe not necessarily as valuable to you as a doctor.
Yeah, no, I agree. I think it's definitely the consumer play is the play to make if you're in that world. I think if you're coming at it from more of the clinical world, that's where I'm kind of interested to see whether some of the, I'll call it hardcore sensor makers who are making things for the labs and for the clinicians, I wonder if they're going to shift a little bit of their attention over to the consumer world and go, hey, I'm going to take this sensor, which I use over here in the lab, I'm actually going to put it in a device because now it's cheap enough to be and put it into a device that an individual person can afford or that the insurance carrier can afford. And now I have that same device that is available to a clinician in the lab now available here at home. I think that's where the world is going to change a little bit to say, hey, that data is something that should be incorporated into the EHR.
Yeah, I still want invisibles though.
Yeah. Yeah. Well, we can have a whole episode talking about, the whole passive sensors that are going to a house to detect falls and detect all those kinds of things. I mean, that's a whole other area that go beyond the wearables that we've been talking about. And that's definitely an exciting area. And John, hey, that brings us to today's sponsor for the episode. And that's our own Healthcare IT Marketing Conference, which is happening this year. And I can say that now, it's 2019. It's happening this year in Boston, April 17th to the 19th. If you're involved at all in marketing for a health organization, a provider, or a health IT company, you've got to come to this conference. This is the conference just for you.
Yeah, and the thing I love about the conference is it's so much more than a conference. It's really about a community of marketing and PR professionals coming together to share insights, share knowledge, collaborate, share resources, in some cases commiserate, and also to have fun. So I love the community feel that we have with the marketing and PR professionals at this event.
Yeah, no, John, I remember when I was a VP at a couple of healthcare IT companies, I would definitely put HitMake on my calendar every year. And I loved it for two big reasons. One, every time I went, I came back with new ideas, new thoughts, new innovations around the different marketing programs I was running. I mean, I always remember the different advice I got around the different content I could use, the different ways I could approach the press. I was very impressed with one year there was a panel of customers up on stage, and we got the chance as an audience to kind of hear from them what actually gets their attention, what emails work, what emails don't, what kind of brochures really work. It was fantastic. So I always come away with some new ideas and some new energy from the conference. And the second reason is just being able to meet and talk with my peers. I mean, a lot of marketers do work on their own. And so to have the chance to sit and commiserate sometimes, but also bounce ideas off fellow marketers is just fantastic. So definitely encourage you to check it out. Again, it's Boston, April 17th to the 19th. You can check out either one of these websites. Go to www.healthitmarketingconference.com or hitmc.com, HITMC.com. Both of those sites will give you information on the conference itself.
Awesome. Can't wait to see everyone in Boston.
It should be fun. So, John, let's talk about some of the predictions you have in general for 2019. What are your top two?
Yeah, so predictions are always fun, but here's my first one. My first one is that two big EHR vendors are going to either buy or merge, or I'm sure they're going to say it's a merger, right? Even though there's really one buying the other, they'll probably call it a merger with another. I could see a Cerner buying a Modernizing Medicine, or someone buying up ECW, with Allscripts, or someone like that. We're going to see some big name EHR merger happen. So that's my first one. My second prediction, this one is a little bit too easy maybe, but I think we're going to have a massive reach of an EHR vendor and especially a cloud EHR vendor that's going to be like, wait a minute, it's going to cause a lot of people to question the cloud unnecessarily, but they're going to question the cloud because of this massive breach. And then just to throw in a little cherry on top, it's going to breach some data of like some star. So it's going to be on TMZ. Like it's going to be the first time an EHR vendor has been on TMZ. Just because some stars data was stored in the EHR in the cloud and got breached, and then they're going to be angry that their data was there. So there you go. There's two big predictions for 2019.
That's interesting. You picked on the cloud there a bit. I mean, is it because of the novelty of it that you think it's going to be reported more? Or is it just more that you think the nature of the breaches is going to be that more severe?
Yeah, I mean, I think it's just going to be the fact that as the cloud, you have to disclose, and when it's internal, they sometimes hide stuff. Unfortunately, it's a violation of HIPAA, but I think they do. I think two, it's going to affect more people. It's going to be a larger breach. It's going to affect multiple organizations, and so they won't have a choice but to disclose. Whereas when it's on premise, it's just your organization, so it won't be quite as big of a news story because it's one organization versus multiple organizations.
Interesting. Let's dive into your first one for a second. So you're talking about mergers. I happen to agree with you. I think there's going to be some pretty big mergers or acquisitions happening in 2019. Overall, is this a good thing for the industry that this is happening, or is this more of like, oh, you know what, big's just getting bigger, and this is not a good thing for the industry?
So I think it might be a good thing for their business. I don't think it's a good thing for the end user, and I don't think it. I think it's especially bad thing for the organization that's being acquired, because they're going to sunset some of these systems, or they're going to integrate them or something, but it's not going to be pretty. And I haven't seen any EHR acquisition that's really been an outstanding acquisition. I think of the soapwares of the world that just decided to shut down. And why didn't he sell? I think it's probably because, I haven't talked to him, but my guess is Randall Oates, knowing him, he just wanted to do what was right by the people and didn't want to just cash out on them. It'll be interesting to see. But I think the mergers are generally a bad thing in the EHR world, especially at the size they are, because a switch is just expensive.
I agree. I think I can totally see what you're saying from an EHR when an EHR company kicks over a fellow EHR company when you're taking out a competitor essentially. I can definitely agree with you that it's not a good thing. However, I see it a little differently when it's an acquisition of something of an area where you're not in, where you're acquiring a complementary player. There, I think it can make a lot of sense. It's still not so great for some of the duplicated departments like finance and sometimes marketing, of course. But I think in general, it does kind of round out the acquirer's solution set, which I think can be a good thing. But here
That's
are my
true. I think you have some expertise too.
here are my two predictions. My two predictions for 2019 are, I think we're going to definitely see some more employer-led initiatives into the health IT world. So last year, I think we saw a lot of the new players like Amazons and the Googles, and there was a lot of attention given to them. I think this year we're going to hear from the GMs of the world, the Boeings of the world, the SAPs of the world in terms of them being an employer getting into the health IT space. The news may be, hey, they've adopted Cerner or they've adopted an EHR themselves. But I think more likely that they're going to use something they've grown in-house to kind of bring now to market for other employers like them. I think we're going to see some of those stories coming out in 2019 because now they're footing the major of the bill and they're going to use it as a competitive advantage to try and get more people on board. The other prediction I have is I think that we're definitely going to see a lot more clinicians leaving hospitals and going into health IT. So this is kind of a little bit around burnout, but mostly around, hey, listen, the grass is actually maybe greener on that side where you get to continue to practice medicine in the sense of you're going to use those skills that you learned, but now you're going to apply it not to just impact one patient or your own community of patients, but now an entire much larger community of patients through this use of technology. So those are my two predictions for 2019.
Nice. So a continuation of the JP Morgan, Berkshire Hathaway, Chase kind of announcement, getting into healthcare, doing some more. The other one's pretty interesting to think about. We'll see how it evolves, right? I mean, burnout's a big thing. I guess I'm reminded of the story where an HR person was talking to this doctor, and the doctor said, "Why are you wasting my time with all this epic training? Don't you know I'm an expensive resource and you're wasting this expensive resource doing the training?" And the HR person looked at him and said, "Oh no, you're cheap compared to the epic trainer."
Yeah, that's I could totally see that happening. So John, last topic for this episode. What do all these predictions mean? Like, how can we make this practical? Because we know, hey, we're at that time of year when everyone's going to be coming out with their articles around here's what's going to happen in 2019. We just did it here on this episode, but how does one synthesize all that? How can you make this useful? All the predictions that are going to be hitting the media right now.
Yeah, I mean, just based on some of our predictions, let me give three ideas. One is evaluate your EHR vendor. Are they looking to acquire or are they looking to be acquired? So understand that. And if you're in the possible shoes that your vendor could be acquired, look at doing some sort of EHR vendor neutral archive. Essentially, it's an HIE with yourself to store that data so that if you do need to switch, you can. So I think that's a good step, to think about and look at it, evaluate that. When it comes to breaches, I don't think I need to repeat, but most organizations need to know you better buck up, you better be ready, you better be prepared. And I almost say a breach is going to happen. Are you prepared for it? And when the breach does happen, are you going to look like you were taking your best efforts, or are you going to look like you didn't care? And you don't want to be in the latter. And then I guess third, using the voice, and even voice and sensors, is take a look at voice. If you're not doing something with voice now, you probably should be considering it. And there's plenty of good partners out there that will help to voice enable you. But look at that, because it's going to be a differentiator. And if you're the one doing it, it's going to be a powerful recruiting tool for patients and for your providers you want to bring to your organization.
I like those, John. I think those are very practical. My additions to what you said is, along the lines of looking at whether your EHR vendor is going to be acquired or an acquiree, I would definitely recommend you look at your EHR and all your vendors in terms of their product roadmap. Have they incorporated sensor data? Are they incorporating patient-generated data? Is that even on their roadmap? Have you even thought about it? Same with voice. How soon is that voice interface coming? How are they doing the iterations around that? I think you need to get to know that, because it is going to arrive here a lot sooner, and you don't want to be caught flat-footed with a technology partner that may not have put it on their radar yet. So definitely would recommend you do that. The other thing I would recommend, especially again along the lines that you mentioned, John, is dive in. There's a lot of things you can do, especially with voice and with sensors on a small scale. Put Alexa in your own office. Start to play with it to see what data you can actually funnel through the Alexa interface or through the Google interface. Try to use sensors that are maybe more consumer friendly. See how those can be integrated or not integrated into your systems today. It may not be your EHR. Maybe the data goes somewhere else to start. Maybe it goes in the lab system. Maybe it goes into some other system. Just play with it. In a sense, what you're doing is getting ready for the day when this becomes more commonplace.
Yeah, is that HIPAA compliant? No, that's a different podcast or episode that we need to do. But the only thing I would offer is create that relationship with your vendor so that you have a voice in their product roadmap, right? So understanding is great, but then also make sure that your organization has an oversized voice, and you can do that through the right relationships. So that's a powerful thing to create when when you're in trouble, when a breach happens, when you hear about a new technology you want to integrate. If you have a voice with your vendors, that's a powerful thing to have and worth cultivating.
Yeah, definitely, John. And that's a great way to end this episode. We are now out of time, and so thank you to all our listeners for listening to this particular episode here at Health IT Today. Please, again, use the hashtag HITSM, and also come to Healthcare IT Today, where you can learn all about the latest news, insights, and innovations that are happening around in healthcare. This has been Colin Hung and my friend John Lynn. See you next time.